Well, hello everybody. Welcome to Community Forum. My name is Roy Cohen. I'll be hosting today's show. Today's special show, as you will see, and you might want to get that pad and pencil ready because we have a lot of interesting and helpful facts to give you. We have our guests from the South Shore Dermatology Physicians. It's located at 31 Roach Brothers Way in Easton, suite number 200. It's a comprehensive dermatology practice, like I said, in Northeastern that provides cosmetic, medical, and surgical dermatology care. There are 6 board-certified dermatologists at this practice. I always thought there was more because of the pictures on the wall, but I guess it's just 6. And with us today are 3 of those dermatologists. On my immediate left, we have Dr. Leery Briceno, and to her left is Dr. Christine Urman. And to her left is Dr. Lindsay Eminger. Welcome, ladies, to the show. Hopefully we'll be able to educate our public. Dr. Briceno received her medical education at the University of Massachusetts Medical School in Worcester. She subsequently received her dermatology training at Howard University Hospital in Washington, D.C., and she's been practicing dermatology in Massachusetts for the past 27 years. Hard to believe when you look at it. She's so young looking. She's a receiver of the dermatology care, I guess. She's currently president of the South Shore Dermatology Physicians.
Correct.
Madam President.
Oh, thank you.
Welcome to the show. Dr. Christine Urman received her medical training at Tufts University School of Medicine, followed by residency in dermatology at Tufts Medical Center. She served as assistant professor and director of cosmetic dermatology at Tufts Medical Center before transitioning to care for patients at the South Shore Dermatology Physicians location. And last but not least is my favorite dermatologist, because I've known her for several years, is Dr. Lindsay Eminger. She received her medical education at Georgetown University School of Medicine, where she graduated first in her class. She has completed residency in dermatology at Cooper Hospital in Camden, New Jersey, and fellowship dermatopathology. Did I say it right?
That's right, yeah.
Couldn't you pick an easier course? At Geisinger Hospital in Danville, Pennsylvania. Now that we got that, let's get into some of the questions that we want to pose to them and see what we get for results. We'll start with Dr. Urman. Okay? We're talking about the process that contributes to facial aging.
Well, this is actually a very important topic, which I talk to my patients about all the time, especially patients coming in for cosmetic procedures, patients that are interested in reversing some of the signs of aging. First, I would like to say that it's important to know the processes of facial aging so that you can make the right choices to maintain the health of your skin longer and to avoid also premature aging. Now, in terms of the processes, there's a lot of stuff that goes into facial aging. They're broken down into 2 categories. There are intrinsic processes, which are the natural processes that are taking place as we speak. Then there are the extrinsic processes, which are the ones that are induced by the environment that we encounter. So I'll start with the intrinsic processes, which are dictated by nature. So what happens as our skin ages, first of all, you have to remember what you see on the surface is just a very, very small part of what's going on. The skin itself has multiple layers. Then under the skin, there are multiple things happening. So I'll start from the top, or from the surface. The top layer of the skin, called the epidermis, becomes thinner with age. And that is just a normal process. The skin cells called keratinocytes, they just don't divide as quickly. So the epidermis becomes thinner. That results in wrinkling of the skin, also in skin dryness. So with age, our skin becomes drier. That is a pretty normal phenomenon. Below the epidermis, there's the dermis. That's where we have our collagen-producing cells, our elastin-producing cells, also a substance called hyaluronic acid, which we'll talk about it a little bit later because that's involved in fillers. All of those compounds or molecules actually decrease with age as well. We have less collagen and elastin and hyaluronic acid with age, both because of decreased synthesis or less of these substances being formed, also because of increased breakdown of these substances. Then underneath the dermis, there's the fat or subcutaneous layer, we call it. Unfortunately, that decreases in volume with age. Unlike the rest of our body, where fat deposits increase with age, fat, where we want it to stay the same, actually decreases. Life is unfair. Mm-hmm. So underneath that layer, there's the muscular layer. What happens with muscles is as we make facial expressions, so such as frowning or smiling, that creates lines. And initially, these are just dynamic lines. They're temporary. So you smile, you frown, then you relax your face, the lines go away. However, with time, these lines become etched into the skin. So they become static lines. Next is the bone underneath the muscle. Bone, we also lose bone density all over our body, including our face. So there's less support for the skin. So as the volume underneath the skin decreases, it results in folds and skin sagging. There's one other process that's happening between the skin and the bone, the fat and the muscle. There is a very heterogeneous group of tissues called the connective tissue, or fibrous tissue, or fascia, some people call it. That actually becomes stretched out and loosened with age. So that, again, results in skin sagging and folding. So those are the natural processes that are happening, that are determined by our genetics. Then the extrinsic processes are, they have to do with our encountering certain things in the environment. So the number one very well studied component of facial aging is photoaging. So that has to do with our exposure to ultraviolet radiation. Ultraviolet radiation accelerates the breakdown of collagen and elastin, so it makes our skin thinner over time. It also causes other things that people don't like in their appearance, such as dark spots, or blotchy discoloration, appearance of red, broken blood vessels. Then, in addition to that, smoking really accelerates aging of the skin. And just pollution, ozone, exhaust, through a process called oxidative stress that damages the collagen and the skin cells as well.
So what's the answer? I mean, to all these bad things that are going on in the body?
Well, I like that question as well, actually, because there's a lot you can do. Even the natural processes that are happening right now as we speak, you can slow them down with certain amount of lifestyle changes and a good skincare regimen. And the premature aging that we get from the environment, you can slow down completely or even avoid it completely. Number one thing you want to do is minimize your exposure to ultraviolet radiation. Mm-hmm. So that would be sun protection of various kinds, putting sunscreen on, wearing a hat. If you're an outdoorsy person, you run a lot, you want to be jogging early in the morning before 10 a.m. or after 3 p.m. So avoiding those high peak hours when the sun is the brightest and hottest. Another important aspect is actually a well-balanced, healthy diet. Mm-hmm. Because these proteins that are in our skin, the collagen, elastin, they need to come from somewhere. They come from food. So if you're on a very restrictive diet, if you're trying to lose weight, or if you're not eating certain foods, you can be deficient in certain proteins or vitamins and minerals, and that will accelerate your aging process. Mm-hmm. Fresh fruits and vegetables contain a lot of antioxidants. These antioxidants fill our natural reserve that fights the oxidative stress that I mentioned earlier. Mm-hmm. So in terms of lifestyle changes, those two are very important. And of course, the smoking that I mentioned, you want to quit smoking. In terms of the skincare regimen, there are a few things that are key. So I mentioned the skin gets drier. Very important to use a good moisturizer at all times. Another important product that you want to be using if you care about your skin and you want to maintain its health and beauty longer is a product called retinol or retinoid products that are derived from vitamin A, actually. And Dr. Eminger is going to talk a little bit more in detail about that. But retinol has been studied extensively. And not only does it treat photoaging, but also it slows down the natural aging processes. So it builds up collagen, builds up elastin, thickens your top layer, the epidermis of the skin. Very important to be using that one product. In addition, I mentioned antioxidants. In addition to consuming the correct amount of antioxidants, sometimes there are certain preparations of antioxidants that you can apply topically, and those will also reverse some of the signs of aging or photo damage.
Okay, which sounds like the thing to do.
Yes.
Oh, okay, new subject. Dr. Briceno,
Yes.
we're talking fillers.
Yes.
You want to explain what a filler is?
Yes. Well, it's a perfect segue from Dr. Urman's introduction, as these days patients readily see the changes in their skin as you age, and being more aware of the ravages from the sun and other environmental factors. But basically, fillers are materials that can be injected into the skin. Some are synthetic and some are biological. You could use fat, for instance, which is a biological filler that can be extracted from areas where you don't want to have the fat and injected into areas where you desire to have plumping of the skin or restoration of volume that was lost, or just basically augmenting an area that may never have had enough volume for your liking. But more popularly, there are lots of synthetic fillers that are now on the market that are quite excellent at rejuvenating the skin. And basically, the synthetic fillers are most commonly either hyaluronic acid, which was previously mentioned, or poly-L-lactic acid, which is a component of some biodegradable suture material that have been used for many years. And one of the other popular ones is calcium hydroxylapatite. And those are great big names, but basically they're the main ingredient in the synthetic fillers that are available on the market. The hyaluronic acid-based fillers are the most popular ones. They are most amenable to being engineered to change the very characteristics of the molecule. So hyaluronic acid can be manipulated to make it more or less elastic, depending on where you intend to inject that filler. For instance, fillers that you would put around the mouth where you have a lot of movement, you smile, you eat, you kiss, you chew, you speak, will need a more elastic and resilient and thinner filler than one that you will use in the cheekbone, for instance, if you wanted to augment or lift up that area, and you would need something that's more supportive. Also, some of the hyaluronic acid molecules are designed to be drawn more to fat or more to water, and so they have all these different properties that render them more appropriate for different areas of the face that you might be trying to correct. Also, fillers are used just to augment or to replace volume or to improve volume in an area where genetically a patient may say, I was born with thin lips, but I've always wanted fuller lips or a more lifted cheek. So fillers can be used for that as well. So basically, it's a product that is intended to restore volume loss or to smooth wrinkling in an area that may have become roughened and wrinkled from either intrinsic aging or from environmental factors such as sun damage that can cause the skin to become lax and loose and dull and wrinkled. So
There's several injections that you need to get to do an area, or when you use the injection, does it spread out?
Typically, yes. So you will require multiple injections, and there are different techniques that can be used to introduce filler into the skin. Most of the time, it's either via a cannula, which is basically a hollow barrel that is shaped like a needle but blunt on the end instead. So it's introduced through a needle hole that you make in the skin, and you run the cannula in the desired area and then introduce the filler via the cannula, or it can be injected directly in with a needle through the syringe.
Are there any precautions to be taken before getting the treatment?
So I like to prepare my patients for filler treatments by having them take some precautionary measures to minimize bruising, which can be a big risk when you do a filler treatment. So I like to caution patients to avoid taking medications such as aspirin, non-steroidal medications like ibuprofen, Aleve, all of the naproxen and medications that are commonplace now for aches and pains that we suffer with every day, to try to avoid having a lot of alcohol. And many of the supplements that we take now on a regular basis, such things as vitamin E and St. John's wort and ginkgo and others, can cause the blood to be thinned or anticoagulated, and as a result can lead to more bruising. So I like patients to prepare for that, and still some patients like to supplement with more homeopathic supplements such as Arnica montana tabs that you may take ahead of time for a few days to minimize the risk of bruising. Also, you want to be well hydrated when you come in for a filler treatment. And of course, for things such as if you're prone to cold sores, imagine you're getting a filler injected around your mouth. Well, that can be a bit traumatic, much like if you go to the dentist and you have an extensive dental procedure, it can bring down a cold sore or the herpes virus type 1. So we can prophylactically treat ahead of time with an antiviral medication to minimize that risk.
Oh. Dr. Eminger,
Yes.
your turn. Are there creams that one could use to help with signs of aging?
Yes,
And this
absolutely.
I ask as a personal question since I'm an old man now.
Well, I think it can be a little bit daunting nowadays because you can go into a pharmacy and you see so many creams that are for anti-aging. You see so many creams that are on commercials and that type of thing. So I think it's always important to speak with a dermatologist if you're unsure what's right for you, because regimens are usually individualized. You know, everyone has their separate goals. You know, they maybe have a little bit of dyspigmentation that they want to even out, or perhaps they have a little bit of fine wrinkling that they want to help. So there's a couple of different things that I brought today. I thought I would just go through what I use every day. And of course, this is just one regimen, but everyone's a little bit different. And we can kind of look at what sort of I use on a day-to-day basis. I didn't bring in face wash, but you know, any face wash is fine. A gentle face wash that's non-abrasive, so you wash your face, and that's what I do. First thing in the morning, I wake up, I wash my face. Dr. Urman already brought up a little bit about the antioxidants. So that's the first thing I use after washing my face. I use an antioxidant serum. This one's got C and E in it, and it's stabilized with ferulic. And basically, you just need a few drops, and you can put them on your fingers, and then you just rub it into the skin. And what the antioxidants help with is the oxidative stress in the environment. Basically, it neutralizes those free radicals that come from the oxidative stressors that Dr. Urman talked about, like the ozone and UV radiation and infrared radiation. So for me, this is the first thing that I put on. Oh, go ahead.
Let's see. Do you want to try some?
Do
It
I?
feels very
Sure.
nice.
Will it help?
Well, just one drop may not, but
Well, and I'm going to get a bill for this too. And do what?
You
just
rub-
put it
Gently
on
rub
your
it
hand.
in your
Yeah.
skin, on the back
just
of
so
the
you
hand.
can feel the texture of it. It disappears quickly.
Smooth.
Yes.
And we all pick one that's a little bit different. This one I find is a little nicer if you have drier skin, but we have ones that are available if you have a little bit more oily skin. So it's all a little bit individualized.
These are available from your practice?
Yep.
Okay.
Yep. And then I put on sunscreen. This one's my favorite, but we sell multiple sunscreens, and there's a lot of over-the-counter sunscreens that are great. We'll sort of get into what we want to use for sunscreen in a second. You can try this one as well, but this one, I like one that's got a little bit of tint in it, but this is one of the most important things that I think is part of a skincare regimen.
This is on the face, huh?
Sunscreen.
I didn't know I was going to get treatment
You'll
today.
you'll be a new man by the end of it.
Wow. Just rub it in? And
Yeah, a little
Gently
bit, rub
on
it
the,
in.
right over the.
What about on my face?
Sure, you may use it there.
It's
Comes
not-
with a little tint, evens the complexion out.
Feels good.
So
What
that's
a
me.
difference.
So that's me. I wash my face, I put on an antioxidant, and I put on sunscreen. And I really do think that, you know, wearing a sunscreen every day is one of the most important. When my patients ask me, I say to them, are you wearing sunscreen? They say, oh, well, when I go to the beach. But really, you're in the car, you know, you get 10 minutes of exposure when you're driving. You still can get UV radiation through glass. So it's important every day to put it on. So I say to people, put it next to your toothbrush so that you don't forget your sunscreen.
What SPF do you recommend?
SPF 30 or above. That's what's recommended by the American Academy of Dermatology.
Above 30 is still effective?
Yep, above 30. Yep, above 30 will block 97% of the UV rays.
So when you're driving, I notice that the certain direction the sun is beating through the side windows, I always put the visor over there to try to block it out.
Sure, that can help, but
Yeah.
but also important to have sunscreen because you're going to still get some of the UV radiation through the glass.
Okay.
All right, and then I also recommend that if you're going to be outside that you use an SPF on your lips as well. So, you know, there's lip balms and all kinds of things that you can find that have SPF in it. And again, this one's an SPF 31. All right, so that's sort of my morning routine. Then you can put makeup on, whatever you like over top, and then you're ready to go. So for later in the day, when you get home and what do you use at night, I tend to come home, wash my face, wash off my makeup, and then I end up putting on a little bit of tretinoin cream. Now, Dr. Urman brought this up, and this is a prescription-based cream that basically is derived from a vitamin A. It's similar to retinol, which is what's over the counter in multiple anti-aging creams, but basically a stronger version of that. So all you need is a little pea-sized amount. Sometimes it can be irritating. So you may not be able to use it every day, but even every other night or every third night, just to incorporate into your regimen, it's a good idea. And this can help quite a bit, as you discussed, with fine lines, dyspigmentation or freckling, and is certainly a great part of a skincare regimen as well. And
You supplied a bunch of photos,
yeah,
of which is before and after. Before with the wrinkles, apply whatever you apply and the wrinkles are gone.
yeah.
Do
So
we have any of those?
yeah, we can talk about those in a second. Those were, we have some that relate to neurotoxins or neuromodulators, which is basically sort of backing up a bit, but something that you would inject into musculature of the face. And that's something that can help to treat dynamic wrinkle lines. So Dr. Urman brought up about dynamic wrinkle lines versus static wrinkle lines. So if you're making muscle movements, then you can create dynamic wrinkle lines, and then over time that becomes etched in the skin, and then they become static wrinkle lines. So I think we have some neurotoxin photos that we can show. Yeah, so this is with neurotoxin injected into the frontalis muscle, which is the forehead. And you know, there you could see the before and after, and when we are moving the muscle, you can see that you're getting these dynamic wrinkle lines and that those settle themselves out. And this type of effect is usually does well for about 3 to 4 months for someone who's starting into getting treatment. And then for more like 3 to 6 months if you're an experienced, someone who's getting this injected regularly.
So when someone takes treatments for whatever it is like that, there's several places that they're injected?
For that one was for the in the forehead. This one is in the glabella, which is the area between the brows. And there's a couple of different muscles that we inject to have this effect, but this is sort of commonly known as the 11s. So for people who develop those wrinkles between the brows, this can be a good treatment for that.
The person doesn't look very happy.
Before, but after, very happy.
Yeah, of course.
And this is crow's feet. This is another place that we can inject neurotoxins or neuromodulators. And you can see sort of the before, you have more of these dynamic wrinkle lines, and then afterwards, those are much softer.
I actually want to say a little bit more about that picture. Go back to the eye picture. Yes.
That one?
Yes, so the muscle that we inject here, it actually spans around the eye, and it covers the eyelid and that area where you see the lines as well, the crow's feet. So if you notice in the before picture, she's really squeezing her eyelids really, really tight, and it's causing these long radial lines to come out. In the after picture, you can see if you look at her eyelid, she's still squeezing her eyelids really, really tight, but the muscle was deactivated, so to speak, further out, so you don't see those crow's feet. So, which is very interesting to kind of see how it works.
I have one other thing to point out about this,
Sure.
Which we don't really have a photo of a brow lift, but we can actually use neurotoxin to lift the brow a little bit. So when we're treating in crow's feet and near to crow's feet area, you can treat a little bit along the lateral edge of the brow, and it actually lifts it a little bit higher. So you can even see in these before and after pictures that the eyebrow is a little bit higher as well. So that's something, another technique that we can use with neurotoxin.
That before picture reminds me of the general manager here, Mr. Michael. He, whenever I bring him stuff to do, he looks at me like that.
You know, it's interesting.
Not again.
On this topic as well, sometimes we treat patients for crow's feet lines, and they tell you that it also helps their TMJ symptoms because it really relaxes the muscles that are in part involved in the whole symptomatology and pain of TMJ. So,
Dr. Eminger,
Yes.
what about tanning beds?
We should definitely not be going into tanning beds.
But I want to get a pre-tan before I go to the beach.
No tan is a good tan.
No tan is a good tan?
No. So what we would recommend is that people don't use tanning beds and that they use sunscreen daily. I think we have a picture of some of the sunscreen recommendations. But basically with sunscreen, we're recommending SPF 30 or above, which we talked about, and we're recommending broad spectrum UVA, UVB protection, and then also something if you're going to be outside or sweating or in a sporting event or going to be swimming, you want to get something that's water resistant, and that usually comes as a 40 to 80 minutes. And then you asked about tanning beds versus and the sun. They both have UVA and UVB rays. And that's considered by the WHO as the World Health Organization as a carcinogen. So we want to avoid that because we know that it causes skin cancer, and both cause we know from multiple trials that UV radiation can increase your risk of all types of skin cancer, including melanoma, as well as non-melanoma skin cancers, basal and squamous cell skin cancer.
So everybody watching, pay attention. Is there a suntan lotion that changes the color? In other words, some suntan lotions are just put on to protect you from the sun. But if you don't want to go to the tanning bed, aren't there lotions that you can put on that gives you a little color?
Sure, there's ones with tint. The one that I use every day has a tint in it, so you
Is that the
can
one I
definitely.
used on my hand?
Yeah,
I noticed the difference.
So you can get sunscreens with tint, and that can certainly help with a little bit of color as well.
I noticed these applicators are small. Are there bigger ones?
Yes, I mean this is for example a face and body sunscreen. So I brought this along as well to sort of show the full body sunscreens, and certainly you can use something like that head to toe. A lot of the facial sunscreens come in smaller.
I was getting nervous.
tubes.
I thought you were going to spray the host.
And they come in bigger bottles because you really do want to put a lot on, a shot glass or so for a full body application if you're going to be outside.
So there's no good tanning bed?
No.
Okay, new subject, Dr. Urman. Back to you again. There's something about laser?
Lasers. So that's another device, I guess. If we think about fillers as devices, laser is another device that we use for facial rejuvenation. So lasers are light-based devices that we use to repair damaged skin or heal damaged skin. The way that lasers work is that they target specific areas of the skin in order to promote healing, improve immune function, improve lymphatic drainage, and build collagen, which are all good things that we want to do. And depending on what exactly we want to treat, there are different lasers for different skincare conditions or problems.
So if you have a problem with your skin, you treat it with laser?
You can.
You can.
Yeah.
And that moves around, I would assume that moves around to the whole area?
Yes. Well, actually, we do have a video to show of
There it is.
Dr. Eminger treating me for rosacea with a laser called the pulse dye laser. A treatment that I get pretty regularly.
Uh-huh.
It's actually, it would be a little boring if we had to show you the whole thing. It takes a few minutes to
Looks
cover
like it
the whole
works
face.
well.
It does.
And Dr. Eminger applies it?
We all do.
You all
we all
do.
do it. Yep. Yep. We have a lot of patients with rosacea. Some other things we can treat. So that laser targets red blood vessels to treat broken blood vessels or rosacea. Some lasers target pigment to treat discoloration or dark spots or sometimes even melasma. Then there are lasers that burn little holes in the skin that are used to treat scars or fine lines and wrinkling. There are lasers to treat unwanted hair, actually. Lasers to treat sun-damaged skin. There are a lot of lasers. And then there's also light devices. Light-based devices that can tighten the skin, they can decrease fat, all kinds of stuff out there.
I can use that laser to tighten my skin, I would think. But
Anyone can.
It takes care of facial hairs?
Yes.
Permanent?
Almost permanently. It reduces the amount of hair, makes the hair a lot thinner. One little caveat is that the hair has to have some color in it because it does target pigment, so it can't be completely white. But it works tremendously well, and it really changes the lives of a lot of people who have to shave a lot.
Not the women, the men. If I wanted to no longer shave, if I wanted to no longer shave.
You could get your hair removed on the face with a laser.
Curious. So basically, who should be operating the lasers? Dr. Eminger or all of you? Or
all of us. So in general, there are a lot of places out there that have these light-based or laser devices. You want to make sure before you go have your unwanted hair removed or your rosacea treated or your sun-damaged skin treated, you want to make sure that the person operating the laser is either a physician or an allied health professional such as a nurse or a PA who has been trained extensively in use of these energy-based devices in their physics, in medicine of cutaneous medicine, cutaneous surgery, that they know exactly the indication of each one of these devices, that they know the pre and post care, that they know the complications, and they can deal with all these things. That's very, very important. So do your research before you go get any kind of laser treatments.
what kind of precautions should a patient be aware of in the treatment?
So number one, you want to avoid the sun. So we can't treat skin that's been tanned because that increases risks of burning or discoloration. And then immediately after laser treatment, you also want to avoid the sun completely because that also increases risk of discoloration during the healing. Your skin becomes more sun sensitive, exactly. Just like Dr. Briceno mentioned, you want to avoid blood thinning agents such as certain medications, aspirin, ibuprofen, alcohol, or herbal supplements that thin your blood because that increases your risk of bruising and bleeding.
All of these treatments that we're talking about, are they all covered by medical insurance?
The majority of these treatments are not covered by insurance, unfortunately. There is a laser procedure that treats birthmarks. Actually, that same laser that Dr. Eminger was using on me, that will be covered by insurance. So if somebody has a disfiguring birthmark on their face, such as a port wine stain or hemangioma, that would be covered.
What causes a birthmark?
Just abnormal formation of skin cells during development of the fetus.
I remember as a child I had 3 operations on a birthmark on my leg, where they cut out the middle and brought the skin together. Did that 3 times, and I got rid of something I figured was really ugly.
Well, yes,
That was a long time
some
ago.
birthmarks require surgery, but some can be treated with lasers.
Okay. Micro needling. Dr. Briceno,
Yes.
what is micro needling?
Microneedling is basically what the name implies. It's relatively one of the newer treatments for treating a variety of skin conditions. And as the name describes, it's a procedure that involves using a device that comes with a head that attaches to the device, and it is comprised of a small cluster of 11 or 12 needles, or a larger cluster of about 25 or 26 needles that can create micro punctures in the skin. And by so doing, it can stimulate more collagen production, and as a result can have an impact on things like acne scars, or dyspigmentation, discoloration of the skin, or to tighten the tissue, or even to give you a more youthful looking texture and smoothing of the skin. So this procedure, microneedling, has multiple applications. We've actually brought along our microneedling device that we use in the office to show. And
The lasers didn't fit in the door, so we couldn't bring those.
we couldn't bring the lasers. But basically, it's a simple pen-like device. This is the device itself, and it comes with an attachment. I brought along a sheath to cover the device to show you that it is really important to have these precautions because you're using the same device on multiple patients, but it comes with a disposable head. And it's on the head that the needles are visible. This is a small pinhead, as it's called. And this pinhead has just about 11 needles in it, and it attaches directly to the device. So this is the attachment part, and this is like the connector that connects to the protected device. So we put the plastic sleeve over. So by having all these precautions, you're sure now that you're not risking transmission of any bloodborne pathogens from one patient to the next. So it attaches to the device, and then this end connects to the disposable portion of the whole mechanism that you use to treat. So each patient gets their own pinhead, depending on the area you're treating. So you could see the needles at the tip, and it's applied to the skin directly after you've pre-treated the patient with a numbing agent. So because needless to say, these are pinpricks that are made on the skin to accomplish what we call the microneedling process itself. The other name for microneedling is PCI, or percutaneous through the skin collagen induction. So we numb the skin, we apply a numbing agent to the skin for about 45 minutes to an hour, and then clean the numbing agent off the skin, and we apply a gliding serum, and the treatment is then started. You could hear, this is the on-off button there basically. And you also set the depth that the needles penetrate. So depending on the area that you're treating, you have to be familiar with the anatomy to know what is appropriate to use on different areas for the depth of the needle to penetrate. And it's glided along the skin, and you glide and treat to the point of pinpoint bleeding. And once you've fully treated, we apply cold compresses to cool down the face and to help with swelling. And we apply a serum, and within a matter of 1 to 3 days, the redness and swelling that results from the treatment very often subsides. But it's proving to be quite an effective treatment for multiple indications.
It's something new?
Relatively new, but it's quite popular on the cosmetic market now.
I think we have a video actually too of the microneedling. It might be a short.
It's another video of you? There we go.
There we go.
So they're really quite comfortable. You know, people have said that it feels like a little bit of a vibration, but you can see that, you know, it's really not very painful.
Oftentimes you require a series of treatments to see appreciable improvement, but it can really do a wonderful job at helping to smooth out acne scars, which many patients who have had significant acne find bothersome and you know, not reflective of the image they would like to carry. So to smooth out some of the puckering from acne scars, or to smooth out the texture from sun damage, or to even help with discoloration in the skin from just basically sun damage, or from some skin conditions such as melasma, which is also known as mask of pregnancy. It's an even flat discoloration that comes on the skin, sometimes in association with having been pregnant or having taken exogenous hormone therapy like birth control pills. So it's been really quite a wonderful addition to our cosmetic armamentarium.
I was waiting for you to apply it to me.
we
Not without
arrange
the
that.
topical anesthesia.
Without it.
No.
Get me. Well, it's very interesting. This is something new, or no?
It's been on the market for a few years, but with time they're discovering new indications for it, and it's become quite popular, and it can be used in conjunction with other therapies to really synergize the result.
Mm-hmm. Okay. Dr. Urman, chemical peel, brief answer.
Sure. So that is a nice segue. Chemical peels are procedures that can be used to enhance the appearance of your skin, usually face, neck, hands, sometimes even chest or back, and can also be used for acne scarring. So this is a procedure where a certain compound is applied to the skin, which creates a controlled injury. So technically burns. It's a chemical burn of the skin. Now, when the skin is damaged, it has an incredible ability to regenerate itself and look much better and healthier afterwards. The only problem is that you have to be very careful to control this type of injury. If the injury is not well controlled, you may end up with scarring. Mm-hmm. So acne scarring is one of the indications for chemical peels. There are also chemical peels that can treat fine lines, discoloration, so all the effects of sun damage or natural aging processes.
Mm-hmm. Interesting. Some of the side effects from the chemical peel?
So immediately you will get some redness and some stinging. You may experience a little bit of itching. And of course, several days later, you can, depending on the type of peel that we're using, you can get some peeling of the skin or exfoliation of the skin. On this picture, you see a superficial chemical peel that was done to treat some of this discoloration caused by sun damage. And on the before picture on the left, you see a lot more freckling than on the after picture, which is on the right. Mm-hmm. So this was done with just one treatment, but in general, we do recommend a series of 2, 3, sometimes 4, and that, of course, depends on how much sun damage you have and what results you're looking for.
So it gets a little red after your treatment, but eventually
Yes.
it goes away?
Yep. Mm-hmm.
It rejuvenates itself.
It does, yes.
I can't believe how many layers of skin you have, what the skin is built from. I just thought skin was skin.
Oh no, skin is an amazing organ. It can do wonderful things. So you better take care of it.
Well, yes, I certainly will. Otherwise, I may get the needle bit. A little nervous about that. Why don't we take a short break with the public service announcements that we have, and then we got a whole nother subject for spider veins. Almost sounds like a movie. Hi, this is Roy Cohen. The crew would like to thank Maxie's Delicatessen, located at 117 Sharon Street in Stoughton. You can reach them by calling 781-341-1662. The American Cancer Society is looking for volunteers to drive cancer patients to and from treatments. You can volunteer by calling 1-800-ACS-6662 or online at www.cancer.org. Ilse Mark's Food Pantry and St. Anthony's Free Market is located at 2 Park Avenue in Stoughton. For more information, call Christine Gallagher. That's 781-341-0611 or 781-341-0549. To get involved with Meals on Wheels, call Jessica at 781-344-8882, extension 2. The Stoughton Penny Saver. Our business is advertising your business in Stoughton. To advertise, call 781-344-4833. Community Forum showtimes here in Stoughton. You can see it on Thursdays, Fridays, Saturdays, and Sundays at 6 p.m., Monday at 8 p.m., Tuesday at 5 p.m., either on Comcast Channel 9 or Verizon Channel 28. If you have any comments or suggestions, contact us at communityforum1@yahoo.com. Samaritans, 41 West Street, 4th floor in Boston, Massachusetts, 02111, or call them at 617-536-2460. The 24-hour helplines, 877-870-HOPE or 877-870-4673. Samaritans, 800-252-TEEN or 800-252-8336, or online www.samaritanshope.org. For you bingo players, I want to tell you about the Monday Night Bingo being held at the Ahava Torah Congregation, 1179 Central Street in Stoughton. The doors open at 4:30 p.m. The games start at 6:30 p.m. You come on down and win some money. They have 2 big prizes. One is $1,199 and the other one is up to $3,000. So come on down. We're going to get into spider.
Yeah.
Oh, here we go. South Shore Dermatology Physicians. They are located at 31 Roach Brothers Way, suite number 200 in Northeastern Massachusetts. And their phone number, in case you want to call, is 508-535-3376. They're open weekdays from 8:30 a.m. to 5 p.m. Great practice.
Thank you.
They'll fix you right up. All the things that ail you. Spider veins. Dr. Briceno, the spider veins, help me with this word.
Sclerotherapy.
That's what it is. Sclerotherapy. What is the...
Sclerotherapy is a wonderful procedure that can help to improve the appearance or completely eliminate spider veins. Spider veins are those non-attractive reddish purple veins, and we have a great example of a nice network of spider veins on the legs.
What do they call? How do they happen?
Sometimes spider veins appear as a result of trauma to an area on the legs, if you're genetically predisposed to it, and it's often seen in women after a pregnancy, or if you gain an excessive amount of weight, or if you're really apt to be on your feet all day, you wear really restrictive clothing. So multiple things can cause spider veins, but genetics is a big part of it, and pregnancy is another. So as we age, oftentimes these spider veins appear very suddenly on the legs, and they are a result of basically backing up of pressure in the vasculature, the venous systems in the legs, causing these perforations on the surface and like a network appearing suddenly of these small spidery veins, and women find them quite unattractive. Some men do too. So sclerotherapy is felt to be the gold standard of treatment to get rid of these spider veins. And this is a procedure that we offer in the office. And we inject different, you may use different kinds of materials to get rid of these spider veins. They're either of three categories. You could either use a detergent type solution and what we call an osmotic solution or a chemical solution. I most often use a detergent solution that is called STS, or sodium tetradecyl sulfate. That is an irritating solution that we inject into the spider veins. It causes them to flush out and immediately become irritated. You see a red response immediately, so you know you're in the veins. And some patients say they experience a little itching or a little burning upon injection, but it's really quite tolerable. The needles are ultra fine. And after the injections, you are expected to wear compression stockings, which when we prepare you for the procedure, we ask you to purchase compression stockings with a certain degree of compression that comes with it, 15 to 20 millimeters of mercury. And so you bring those along. After the treatment, you put them on, and you're expected to wear them during the daytime when you're out and about for the ensuing 2 weeks to help to keep the treated vessels flattened with that compression.
Are the results, you notice the results right away?
Well, you see the red response and the swelling and maybe a little itching and burning, but the actual clearing of the spider veins you see more weeks later, like 4 to 6 weeks later. So I try to set my follow-up for sclerotherapy out by 4 to 6 weeks, because you destroy the vessels, and all of the proteins that are included in the blood in those vessels, like hemosiderin and hemoglobin and all of that, can stain the skin a brown color, and that has to be scavenged away by your immune system, and that can take weeks to occur.
What are the risks?
So, it is really imperative when you're deciding on these procedures to make sure that the person performing your procedure is well qualified. We're all board certified dermatologists, and some of us do cosmetic dermatology. And we are intimately familiar with the anatomy and the physiology and the risks that could come with this. So risks would include the immediate things, the redness, the swelling, the itching, the burning, but also you can have risks of clotting that could embolize or be spread to a deeper part of the venous system. So, you have to be properly screened and prepared, make sure you don't have any underlying medical conditions that could complicate a procedure such as this. There are some medical conditions that predispose us to easy clotting, and so you would want to exclude patients with such risks from a procedure like this.
Okay. We have some photos that we can quickly talk about, I believe. I believe there's dead air right now.
I think we're thinking about doing some before and after Botox photos, but while we're talking about that, just wanted to bring up this. So when people come in for their Botox injections, just so you know, we use really fine needles. So I brought this also to show, but we got some before and afters now as well.
So this is basically an excellent filler patient, and these photos are courtesy of the filler Galderma, the company that makes the filler that was used here. And if you notice around the patient's mouth on the left side, the before picture features a very deep line at the side of the nose extending down to the sides of the mouth and onto the jawline. And in the post-treatment picture, it's a much softer look that allows the face to look more youthful and rejuvenated. And here, a similar treatment. She has had filler treatment in the cheeks and a little bit around the mouth, so you could see a softer look in the cheekbone area and around the mouth where Restylane was injected.
This is a nice example of a lip filler, actually. So somebody who has naturally very thin lips, and a little bit of aging as well, which deflates the lips with time, especially photoaging, which decreases collagen. And then in the after picture, the lips look completely natural with just 1 syringe of Restylane Silk injected. She doesn't look overfilled, she just looks like she has naturally fuller lips.
I guess that's it. We have one last question that I want to pose to Dr. Eminger. Photo damage and aging. What is? We've talked a lot about that throughout the hour, and I appreciate what you had to say. Can you tell me what signs may be worrisome for skin cancer?
Well, it is Skin Cancer Awareness Month,
In the last
so
minute.
it's important just to touch base on that. We always want to be on the lookout for the different types of skin cancer. We think about melanoma most commonly, but that's actually the least of the 3 most common types of skin cancer. So we sort of subdivide them into melanoma and non-melanoma skin cancer. For the non-melanoma skin cancer, oftentimes we're looking for a pink bump, a pink scaly patch, maybe looks like a sore ingrown hair that's not going away, or something that's easily bleeding. So that would be something that you'd want to keep an eye out for. And if you got something like that that's stuck around, we'd want to see it. And for melanoma, we talk about the acronym A, B, C, D, E. So A is for asymmetry, B for irregular border, C for irregular colors, multiple colors, something that doesn't match the rest of your skin tone. D is diameter greater than a pencil eraser, and then E is for evolving. Anything that's growing, itching, burning, changing, bleeding, something that looks like it's evolving would be another mole that we would want to see to evaluate.
Okay, well, we thank you all very much for your information and for coming to the show. We look forward to having you back again. And before we sign off, I definitely want to say thanks to Mike Hammond, who did a lot of preparation for this show. We couldn't really do it without him. And Jeff Pickett and Dave Young and CJ Mullen, all very helpful staff members to make this show happen. We appreciate it. If you have any questions, please get in touch with South Shore Dermatology Physicians. It's in North Easton. And make an appointment and go see them, and we'll be all set. This is Roy Cohen saying thank you very much for watching, and we'll see you again.